I want to discuss about one of the most stressful profession in the medical field known as psychiatry. Psychiatry means it's very emotional field because every time brain disorders, brain diseases in the patient, which is very stressful for the doctors how to manage that situation. First of all, it's some quotations which I want to explain. One is words of comfort skillfully administered are the oldest therapy known to man. It's one of the most oldest therapy uh, for the man, which is preferred by Lewis Nizar. And other is even a happy life cannot be without a measure of darkness. And the word happy would lose its meaning if it were not balanced by sadness. Means happy life cannot be without a measure of darkness. Why? Because the word happy would lose its meaning. Because in the world, every time man is in stress condition, so it's due to some business, it's due to some social problems. So it doesn't matter, but sometimes he feel very nervous. Another quotation which is sorrow, the sorrow which has no vent in tears may make other organs weep. If you don't have tears in your eyes, it means there is no stressful condition. Every time it's impossible to be happy in the life. Every time it's very impossible. It's too much impossible to be happy because it's a part of life. Without dangerous condition, without any risk factors, you will not be genius. You will not be good. So sometimes more diseases, more risk condition, more risk diseases happens in the brains, which is known as psychiatry, and doctors manage this deal. One is Jonathan Harnest. I have schizophrenia, but I am not schizophrenia because psychiatric every time studying the patient brain and every time studying the condition, how is the disease level. So one what right their quotation which is I have schizophrenia. You think that he has schizophrenia, but actually I am not in schizophrenia condition. I am not any my mental illness. My ill is a part of me. He said if I think too much, he said if I isn't manage my life uh, in a daily routines, I will be in stress condition. That's a part of the mental illness. So psychology is a very difficult profession. If the person wants to choose psychology, first he need to manage his emotions, but first he need to try to understand his uh, stressful condition, how he manage himself, because psychiatric patient will not be in normal condition during in front of the doctor. Psychiatric patient will not be in normal condition in front of the doctors. Why? Because it's a mental illness, and if he has some unconsciousness disorders which disturb every person. So how can we study psychiatry? It's a classical condition in which learning uh, of a natural response, and it is a stimulus that previously was presented in conjunction with an unconditional stimulus. We have receptors in our skin, and these receptors, when a lot of receptors take signal and that signal goes into the brain, when the signal goes into the brain, it means a lot of signals, then brain will not be manage that signals, and there is no motor response, and your brain feels a lot of stress. That's the situation. Main reason is, according to physiology, when a lot of signals goes into the brain, and when signals will not converted into the motor signal, that's the reason of unconsciousness. It's an involuntary response. Usually, it's an involuntary response. Operant conditioning, learning in which a particular action is elicited because it produces a punishment or reward, usually elicits voluntary response. Operant condition in which how can we manage the patient, how can we deal with the patient if he is in involuntary condition, how can we convert involuntary response to the voluntary response. There is a reinforcement, target behavior, and punishment, repeated application of oversized stimulus. It's a positive punishment. How can we manage with social uh, way, how can we manage with the social way to deal with, how can we deal with the patient. Extinction, discontinuation of reinforcement, positive or negative, eventually eliminates behavior, can occur in operant or classical conditioning. When the psychiatric, I don't want to be a psychiatric in the future. When the psychiatric deal with the patient, his behavior sometimes is positive, sometimes is negative. It depends on doctor treatment. That's some information. Transference and counter-transference. Transference is a patient projects feeling about formative or other important persons onto physician. Psychiatric is seen as parent. Patients have unconsciousness, and the psychiatric treat like a parent. And a counter-transfer is a physician project feeling about formative or other important person onto patient. I hope you understand. They remind physician of younger siblings. It's for younger siblings. The doctor deal with the younger siblings mostly. Another which is psychiatric problem, it's ego defenses. It's an ego problem. Mostly persons nowadays, many young guys have ego problems. They think that they are most powerful, and they think that um, they have good behaviors and other. But if they go in front of the psychiatric, then psychiatric understand what kind of uh, psychological problem the patient have. Not a problem, but I think psychiatry, it's uh, it's uh, it's not a perfect medical field. Doctor will also be normal in will not be in normal condition. Doctor, because every time they think about unconsciousness of the patient. That's also mental disorders. Acting out, subconsciously coping with stressors, or emotional conflict using action rather than reflection or feelings. It's a patient skips therapy appointment after deep discomfort from dealing with his patient. And this line explained that how can we use our skill